Dr. D again from Advanced Healing Institute. This is our third and last video on arthritis. And in this video we're going to talk about rheumatoid arthritis and its treatment. So as we mentioned before, rheumatoid arthritis is an autoimmune inflammatory process where your body actually attacks itself. So the goal of treatment in rheumatoid arthritis is to stop this autoimmune process, mainly by medications. The first line of medications that we use are the non-steroidal anti-inflammatory drugs, such as Advil and Motrin, just like in osteoarthritis. The other medication that we use is oral prednisone or oral steroids. So both of these help suppress the immune system, but as we know, they can have a lot of side effects, so they're usually not used in the long run. The next class of medications includes the DMARDs, which stands for disease-modifying anti-rheumatic drugs. And they fall into two categories, the non-biologics and the biologics. So the non-biologics basically help suppress the immune system from attacking itself, such as methotrexate and cyclophosphamide. These agents are used as first-line treatments. If the result is not good, then the biologics may be used. And biologics are basically newer, more specific agents, which instead of targeting the entire immune system, it actually targets the cells that are attacking your own self. So they're more specific, they have a more rapid onset of action. So they can also be used. So basically it comes down to your individual response, including the side effects that you may have with the certain medication that you use. Finally, in terms of injections, steroids are used to help people suffering from rheumatoid arthritis because they help lower the inflammation. Platelet-rich plasma is not used. As you can see, platelet-rich plasma have an inflammatory component, and that is what we're trying to suppress. So really the mechanism of action doesn't go with what rheumatoid arthritis does and may actually worsen the flare-up. Hyaluronic acid also is not used because that's lubricating the joint and it doesn't really address the issue of the inflammatory component involved with rheumatoid arthritis. And also surgery. So in the severe cases, you may need surgery such as arthrodesis, which is fusion of the joint, which stops movement between the joint when you're fused and helps stop the pain, or replacement of the joint, arthroplasty. So hope that helps answer your questions, and continue to ask your questions through the website. Thank you.